medical respite or a medical recovery center is a place where homeless people who are sick, have been in the hospital, suffering from a variety of infections, injuries, cancer, need operations. It's a place where they can go and be safely cared for when they don't need to be in an expensive hospital bed anymore, but they're way too sick to be out in the streets or out in the shelters, and very vulnerable to getting sick again and going back into the hospital. So it's an effort to fill a gap in the services that really homeless people need to keep themselves healthy and avoid the perils of being on the streets. We had to start the first medical respite center in the United States in 1985. It was September of '85, because the homeless people that put our grant together in Boston, which was a grant to try to integrate the care of homeless people into the mainstream of our healthcare system. The homeless folks were so upset with the healthcare system, mainly people like me in the hospitals, for discharging people when they were still very sick to the streets or to the shelters, when really they needed a home to go to with a lot of support from family or a visiting nurse, but they didn't have that. So they insisted that we open up a place where people could safely go as they came out of the hospital, or in some cases as people were in the shelters or on the streets and very sick, but could go to the respite program to avoid going to the hospital. So it was really started by homeless people. It was their idea. Wish we could claim it, but it's turned out to be something that's been invaluable. And now, certainly in Boston, it's just become part of the system of care. We can't imagine living without it now.